And hey, Kevin.
Hey, Drew.
Hey, how's it going? How's your Thursday going?
It's going well. Just got out of a meeting. You know how it is.
Yes, yes, I know how it was for sure. So yeah, let me just once again introduce myself to the audience. I'm Giovanni Colin. And Kevin, thank you for taking the time to chat with me today. I just
Thanks for
want to
having
let
me.
you know that this interview, what this interview is really about, and it's just about talking about tech, right? Just a tech conversation. My goal is to break things down in a way that's easy to understand, whether someone is just starting out or already in the field. I'm not here to quiz you or make things overly complicated. I'm just hoping we can have a good, honest conversation about tech, what you do, and why it matters. So feel free to keep it simple, share your perspective, and let's just talk. Let's just talk. Okay? Sounds
All
good?
right. Sounds good.
All right, before I ask you the questions I had sent you over already, can you just let our audience know your name, your title, and what do you do?
Okay. So my name is Kevin Rodriguez. I'm the Director of Revenue Integrity here at Doctors Hospital Renaissance or DHR Health. I've been in IT for almost 20 years now, and I've had a range of jobs from help desk all the way into networking to coding to database. And I was a technical analyst. Worked kind of with BI for a little bit. Uh, Systems applications as well. And now I'm the director of revenue integrity. Um, Graduated from UTPA before it was UTRGV. I have a bachelor's in computer information systems, master's in information technology. Uh, I mean, I don't know, that's about it. So let's go forward. I think that, okay.
Yeah, and just to tell our viewers, you and I go kind of a little bit back, right? We started working together in 2020, and we've been kept in touch ever since. And we were coworkers at one point, and then you went ahead and left to another department within DHR. I worked at DHR at the time, and then you came back to be my boss. You were the director of revenue integrity. So yeah, let's just jump right into it. So I did send you over some questions. So I'm just going to start with number one. What are some of the biggest technological challenges facing healthcare today, in your opinion?
Okay. Well, I mean, some of the obvious ones are security, confidentiality of our patient information. That's almost a given, but we have the viewers, I mean, people listening in have to understand that healthcare, as much as we care about helping our patients, it's also a business, right? Either for profit or not profit. And one of the biggest IT issues that we have is as big organizations expand, big data. It was a big thing coming in about a few years ago. And big data, especially for healthcare, all the clinical data, all the billing data, all has to intertwine together, and we have to make sense of all this data. How we identify trends, how we can better make money to use to help our communities in the long run, right? And when it comes to big data, uh, we also have to think about the small clinics, the small hospitals that are also trying to get big. They have an issue with interoperability. And so that means that our legacy systems, like when a clinic or a small hospital starts off, they have the original uh, system that they use. And as they get bigger, they start talking to other hospitals, they start bringing in newer programs and apps that are supposed to be the best of the best. But there's a big problem with the communication between the systems, right? We're talking about legacy systems versus the new. And so sometimes you have to develop a middleware, something that communicates in between the new and the old. And that's a big problem, especially it costs money. It costs money to get big. So there's going to be time frames where the hospital is going to do an upgrade and you fix the issue between the legacy and the new system, and then you convert over into the big new system. And that all takes time, that all takes money, and it takes a variety of different of IT experience to work together to get it done. Um, what else do we have? Well, I mean, and of course, the business itself for the hospitals, we have to take into consideration, you know, the cost and because we all want to be the best of the best, right? And it just takes money to do that. But what we need to upgrade first, like do we upgrade our networking? Do we upgrade our servers? Do we upgrade the systems that the end user uses? What comes first? What comes last? What's more important right now? What's not important? All of that is also a big issue for the healthcare, right? So, I mean,
No, yeah, no, I totally understand. It's there's a lot of things at play, and what better person to kind of have everything put together than somebody like you. You've been in the hospital for quite some time now, and I've seen you grow and just learn just about everything in the hospital. So, and I'm just glad to have somebody with your knowledge come in and talk to me and kind of explain, the stuff that goes on in the hospital for sure. So, thank you for that. So, let's go ahead and move on to the next question. What role does data analytics play in healthcare IT? What kind of insights can you gain?
okay. So I guess the viewers got to know. I mean, a lot of people, when they think about IT, they think about the guy on the help desk, the guy fixing computers, the guy who fixes your screen, and the guy who fixes your hard drives and stuff like that. But IT has evolved so much since back then, right? I'm not that old, but I mean, I've seen it all. And for analytics, it was a big thing about 10 years ago, maybe 20 years ago, where we're starting to visualize data. Big data was starting to come up. How do we make sense of all this information that's coming in, right? And for analytics at the hospital, we can branch it down to two things, and one of them is clinical, right? COVID was a big example. COVID coming in, what were the symptoms, right? How do we get all this information with patients coming in with the same symptoms? What worked on treatments? What didn't work in treatments? What medicines worked? What not medicines worked? You start, diving down, and we realizing that hey, the Hispanics are getting hit harder than other ethnicities, and that's how we come up with the game plan to handle and deal with COVID, right? And that's all coming from data. That's all coming from clinical data. Someone is pulling all this data, giving it as a report, and showing it to doctors, higher end, to make the decision to help the community. Now, when it comes to the business side of the hospital, we're talking about money, we're talking about claims and what the hospital submits. Um, Sometimes there are issues with payers, which are insurances, right? They'll find any way to not pay you, but if we can get in front of the problem, identifying, hey, like, hey, there was a change that we missed 6 months ago, and now they're starting to catch up to us. We save the hospital money, right? Uh, when it comes to analytics, that's kind of the thing that we do here. Those are the two branches. One seems more interesting than the other, and I'm on the other side. I'm on the business side, right? Um, but as in operations of the hospital, when we look at analytics, we look at workflow, we look at how cash flow, um, making sure that we are up to par with our competition or state and national wide averages for what we charge, et cetera, et cetera. And that all takes analytics. It all takes about gathering data, making sense of the data, providing it to the higher ends, and make a decision at the end. And that's the role that analytics plays.
Yes, no, it was, I know for sure, I was able to work with the Excel spreadsheets and create dashboards, and I got to see firsthand um, how to create the dashboards, right, and grab all the patient data and kind of have that given to the higher ups, right, to make some decisions. And I know it plays a very important role for sure. So
Remember that
thank you for that.
remember that when we were submitting for COVID and how we had to get the demographic, like all the patient information out of somewhere and fill out the forms to submit. You remember?
Yes, yes,
Yeah.
I do remember that for sure.
So that's what we did, and we had to gather all this information, organize it, and make sure that we got everyone and we submitted. That way, the hospital could get paid. Um, and this was just scrambled data all over the place because COVID was pretty wild back then.
And you can speak on that a little bit more, right? That it was very disruptive.
Oh yeah, it was disruptive. Not only personnel wise, right? Because we had to stay separated from everyone. Remote working was becoming now the thing. How jobs transformed from being in person to remote, you know? Um, and a lot of it was analytics, right? How do we keep track of who's doing what? How do we maintain the operations was still going just as good as when people were here, right? And what worked, what didn't work. All of that was using information to make those business decisions to keep the hospital going. So, yeah.
Thank you for that insight, Kevin. Moving on to the next question. Are there any emerging technologies that you have seen having a major impact on healthcare IT in the near future?
So, yeah, yeah. Like, there is actually two, and one of them is coming up in a lot, and it's AI, obviously, right? And AI is one, but the one that came up about 10 years ago was biotech, right? And this is where we are starting to merge and augment human with technology. So we're talking about brain chips or microchips in our brain, or even prosthetics that think for themselves, right? Think of an eyeball implant that is able to record 24/7, or people that are cannot see getting implanted with like Neuralinks that they can now see now, right? Like that is upcoming. I know for a fact that it'll be here probably within my lifetime, but not too soon. But the more the more uh not well, the more emerging one is AI. And now how AI helps or goes against in the health industry, we're talking about AI that is able to now read charts and give a diagnosis, right? Based off all the background that AI can handle, right? We have AI that's able to read an X-ray and determine what's wrong instead of having someone that's been studying for years to make these determinations. You get me? Um, these are things that are upcoming, and I know for a fact that we're gonna have to make a decision on how do we control AI, government or on the government level. Um, just because of recent, I don't know if you've heard, but there are some AI that are starting to become self-aware. Like I could send you the link later on. Maybe you could share in the links below on your video. But there was an AI that's task was given a task to do something that it knew it could not do, and the AI was trying to recode itself to to make that task done. That's crazy. To go against its rules and then try to overwrite its own code so that it could fulfill the task. That's crazy.
No,
So
that is very wow. I mean, it's coming up fast before you know it, it's gonna be here.
so AI in the healthcare, like I mentioned, like it's going to start replacing jobs and replacing doctors, maybe on just the basic clinical levels that patients are coming in. Maybe they put in their symptoms. AI reads their symptoms, looks at the tests, like the blood tests and the X-rays and MRIs, and then comes up with a diagnosis like a lot faster than a doctor could maybe. Um, We're talking about walk-in clinics that no longer require, they can be open 24/7, you know. They just walk in. Someone's probably going to be there to draw blood. I don't know if they'll have a robot at that time, but they can do all the analysis themselves and come up with a diagnosis and then treat you when it comes to like a walk-in visit sort of deal. So that's
And is
something.
that some kind of internal discussions you're having right now at DHR Health, or is that something that you're
No,
just, oh,
this is something that I've seen on the outside, usually in the European, Asian. I've read online, I've seen videos online about like some stuff like that, and it's upcoming. I don't know when it's going to be allowed here, but it's just ideas that people are witnessing. People, that's how they want to use AI. That's how they've been experimenting with AI, and it only makes business sense if we can have an AI come in and take a load off of our basic visits, right? uh, Nothing too emergent, but something like you have a runny nose and a cough, and you can confirm, hey, you got a sinus infection. You instead of waiting 2 hours at the doctor's to tell you pretty much what you already know, but you need someone to see you to give you the prescription, that could be done in 10, 15 minutes. You get me?
yes, no, I appreciate that insight, Kevin. Thank you. So last question before we wrap things up. This one's kind of loaded and I'm excited about it, but it's nothing new to you because I sent this one over to you. So let's go ahead and get started with the last question. How does IT support different departments in the hospital, from clinical staff to billing and administration?
Okay. I think I've mentioned it before, but at least in a healthcare standard, you have IT that's separated into different branches. And the main branches, obviously, hardware, uh, networking, database, right? You have someone maintaining the tables of information that the hospital has. You have people maintaining the security and the connectivity between systems and end users on their PCs, networking, and then you have the people that are handling the phone calls from the nurses or from business office staff that the computers aren't working, it's not turning on, or they can't open an app and stuff like that. And then as we get more specific on the clinical side, now I mean, not a lot of people are aware. There's a bunch of systems that healthcare uses to do a lot of things, from labs to X-ray taking, to holding all your previous history, to hold like your medical record, to what else do they have? So they have labs. They have actual like diagnosis panel to where they do like a check off of a bunch of criteria to try and diagnose you. And this is clinical notes and clinical documentation that doctors use to make a determination and see what's wrong with you, or to proceed how to provide care for you. All of this is documented, all of this is recorded and stored in systems. And it's not just one universal, it's every kind of service has its own system, from the diabetes clinic to the cancer clinic to urology. They all have different kinds of systems that are tailored to like the questions and the data they need to record to make a diagnosis or treat the patient. And all of that needs to be maintained by someone. So in the hospital, they have a thing called enterprise apps, and then they have a thing called the clinical apps. So anything that has to deal with, you know, hospital health information, that's the clinical, and anything else other than that would be the enterprise apps team, at least. And um, and that's just the system side. Now, on the business side of things, we have our claims, um, our claims apps that we have, right, that we submit our billing for all the charges that we do for our patients. We have other apps that deal with upfront collections, our QA on how long a patient stays at the hospital in between visits, as in like you walk in to register yourself, you're gonna get an X-ray done. How long does it take you to get from point A to point B, from point B to C, and then out the door? All of those points are recorded to give a insight of how long it takes the patient per visit, right? Because we always want to make sure that the patient has a great experience and they're here in and out as fast as possible with with the most care that they can get. There's a system for that, and someone has to maintain that as well. We have contract management where we deal with our payers and we review, how much we're going to get paid per service. We have an app for that. We have, uh, I mean, besides our, our own Excel and Word and stuff that we have on our desktops, all of that needs to be maintained by someone, right? And even though there is the enterprise apps team, sometimes departments and other hospitals, they have a position to where you're the middleman. You're the middleman between the business side and the IT side, and that's kind of how I felt when I walked into DHR. I walked into DHR as a technical analyst, and I ended up being the middleman between the business side and the IT side. So whenever there was a problem, I knew the information that the business office wanted, how they wanted to solve the problem, and I could translate that to the IT side. All the requirements and what they needed and wanted, I was able to translate that over. And a lot of people um, are unaware about what goes on, right? That there is a middleman that, takes the request and translates it over and then kind of comes back. And then out of all of that, there's still someone that has to deal with the information that we get. The clinical side has a business intelligence side, and so does the business office has a business intelligence side. And what we do is that we gather all this data and we transform it to a visual aspect, right? How much of patient refunds are we doing? Why are we doing these patient refunds, right? How much did we collect the first time the patient, walks through the door? Did we meet what their co-insurance and deductible were? And if we didn't, why not? And this has to be visualized to see and give a clear picture on what admin needs to do or train their upfront staff on the clinical side, right? On the clinical side, you have to gather information about patients and are we actually treating these patients to the fullest, right? Are we missing something in the back end? Is there missing procedures that we didn't do, right? So all of that comes into play, and everyone in IT is important. They do their job. We all work in sync, and that's the way that the organization thrives.
And on a some kind of similar note to this question still, every single time because I follow DHR Health. I mean, I follow everywhere I've worked, whether it be DHR Health or South Texas College, but DHR Health in particular. I mean, every time I see they're offering a new service like the eye clinic, how are you handling, DHR is growing. How do you handle it? I know you're very vital. You're kind of right in the center of everything.
So, I mean, are you talking about like my job, like how I handle that, or the organization in general?
Yeah, you. Yes, I'd like to stay on
Okay,
on
so
you.
for those who don't know what revenue integrity means, right? Basically, my job is to ensure that all patient services that are provided by the hospital, we capture, or my team and my department, we capture in charges and we build them out, right? So when we bring in a new service, right, there's a whole committee that goes over and reviews. The doctor says, "Hey, I want to make a new clinic. I'm going to be located on Dove and Trenton, uh, and I'm going to do all these services, right?" So it's my job to go over all these services, right? Make sure they're reimbursable, meaning that the payer or the insurance company is going to pay us per visit, so to speak, right? And once the committee approves that, yes, the doctor's going to come in, we've already allocated a workspace or like an office, right? Um, my job is then to create or direct my employees to create a charge code per services, right? Per procedure, and then any items that we use. We're talking about pharmacy, and if it's a little surgery clinic, like maybe lenses, like ocular lenses, we have to create charges for that. Supplies, we create charges for that. And we have to make sure everything is ready to go. We allocate our costs. We have a reimbursement formula, and that's how we charge the patient. And then after everything's ready, set to go, we open up the doors. We have to make sure uh, that the systems communicate with each other, right? Doctors, they have the tendency to love their old legacy systems, and so as IT, you have to make sure that one, that it integrates with our main health information system, right? And then two, we have to make sure that it works, that whatever charges that he puts in his system, it mirrors through and goes over to the main system to make sure that, everything is it matches up. And so at the end of the day, I have to make sure that all procedures that were done or any services provided to the patient were captured and were billed accordingly. And then we maintain, right? Because sometimes doctors, they perform a new surgery or they switch over a new item, and and they cost more, or if it costs less, we have to adjust the cost. And all that information, right, with charges and the cost, it all goes down the pipeline. And we have our BI team, we have project managers that get all this information for cost, right? And they do an analysis to make sure that, hey, that this doctor is, not to be mean, but just that it's profitable, right, for the hospital, right? We want to make sure that patients that go to the hospital, that they, uh, as much as we want to provide the best care for them, we got to make sure that it's profitable for the hospital, right? And a big instance is Brownsville, right? Brownsville opening up. At the first hand, we had a really hard time getting that going, but now it's starting to leaf. It's providing more services, more doctors are going over there. So now it's good now. And of course that, and I maintain charges from over here in Edinburg all the way to Brownsville, all the way to Rio Grande. So all those clinics in between, they go through me. So just if anyone wants to know.
Yes, no, yeah, and round of applause for you, Kevin, because I know how hard you work, and it's just been amazing to have sat down with you and talk to you about all this stuff. And I'm glad that we're getting it out there, talking tech, and I just know that DHR is ever growing. You know, it just keeps growing. That's for sure. So yeah, let me just wrap things up. Kevin, do you have any social media where people may find you? Do you have like a business or something that you want to kind of let people know about?
No, I don't have anything like that. I mean, if you have any questions, if you want to talk IT, I'm available on my LinkedIn. You can find me at DHR and then just search up Kevin Rodriguez. And I had some people message me, former colleagues and stuff like that. Always, always there to lend out some information. Um, and I think, I mean, that's the only place really I have keep any contact professionally, right? So it'll be LinkedIn. If anyone has any questions, anything about the hospital, I'll feel free to answer that.
Yes, thank you, Kevin. Thank you for this little chat with me today. I appreciate it. I won't take too much of your time, and I hope you have a great rest of
Great.
your day.
All right. Thanks for having me.
All right, thank you.